My name is Dr. Jeff Dolgus, and I'm a general dentist here in Orchard Park, New York. I've been practicing dentistry since 1996, and I first discovered the LANAP procedure in 2005. I liked it so much I became an instructor with the Institute for Advanced Laser Dentistry, and I've been teaching other dentists how to do LANAP since 2007. I personally believe that LANAP represents the most significant breakthrough in the treatment of periodontal disease over the last century, and I wanted to make this video to help people understand what LANAP actually is and how it's different from traditional periodontal surgery. This procedure can be appropriate at any stage of periodontal disease, but the wheelhouse, the sweet spot, seems to be when there are generalized pockets between 6 and 10 millimeters, not a ton of gum recession, and generalized inflammation, which means that your gums probably bleed when you floss or when dentists or hygienists clean your teeth. But the primary goal of most periodontal surgery, including LANAP, is to reduce the depth of the pockets between the gums and the teeth and to slow down or arrest, or maybe even reverse, any bone loss that has occurred. The traditional approach is called osseous surgery, or sometimes flap surgery. In this type of surgery, an incision is made, usually cutting off the top layer of the gum tissue. Then the gums are peeled back off the bone, which is then reshaped and recontoured to make it smoother, and then the gum tissue is repositioned and sutured back into place. This technique effectively reduces the depth of the pocket by cutting off the top. Conversely, the objective of LANAP is to reduce the depth of the pocket from the bottom up by setting up the conditions under which your body has an opportunity to regenerate connective tissue and bone. The LANAP procedure uses a specialized laser called the PerioLase MVP7, which is a powerful near-infrared laser called a pulsed ND YAG. This laser was specifically designed to selectively remove the inflamed and infected gum tissue inside those pockets, while preserving the healthy connective tissue that sits just underneath the surface. The laser also vaporizes many of the destructive bacteria that are thought to cause gum disease. Using a laser instead of a scalpel also creates a bloodless field, which allows us to better visualize the root surfaces of the teeth. Then we can use special ultrasonic instruments to remove the deposits of tartar or calculus that have built up on these root surfaces over time. These instruments use vibration to dislodge the tartar and then rinse away the debris with a disinfecting solution. The laser is then introduced again at a different setting to remove any remaining infected tissue along the bottom of the pocket and to complete the disinfection of the surgical site. The heat generated by the laser stimulates the formation of a sticky fibrin barrier, which acts as a biological bandage, allowing the connective tissue and bone to heal more completely over time. Now, this is a surgical procedure, so we do have to use local anesthetic, and that means shots, a bunch of them. We're going to be treating half the mouth at a time, which means the entire half of the mouth, upper and lower teeth and gums, need to be numb. For most people, that's the hard part. Once the anesthesia is done, believe it or not, the procedure is generally pretty relaxing. I've even had a few people fall asleep in the middle of it. But if you do have a significant fear of needles, then you might need to be sedated. I don't administer sedation anymore in my practice, so if this is a deal breaker for you, you're going to need to find another LANAP dentist to do your procedure, or choose a different type of surgical approach. So after the surgical phase is complete, we do have one thing left to do. We have to balance the way the teeth fit together by making what's called occlusal adjustments. This means we have to selectively grind on and reshape the chewing surfaces of the teeth, the cusps and the grooves, so that they fit together in a way that minimizes the forces from clenching and grinding. And we all clench and grind. And this is especially true for those teeth that are in the most periodontal distress. A proper occlusal adjustment will redistribute those forces to the teeth that are the most stable. And this is one of the main reasons I prefer to do the LANAP procedure on one half of the mouth at a time. If I've treated the right side, it means I can significantly lighten up the contacts on that side at the time of surgery. And then after that right side has had a couple of weeks to heal and stabilize, I could treat the left side in a similar manner. The occlusal adjustment is one of the most important steps in the LANAP protocol, and it should never be ignored or skipped. And in my experience, most LANAP patients report that their bite feels better and more stable after LANAP than it had previously, even when they weren't aware of any imbalances. After the LANAP procedure, most patients report mild to sometimes moderate soreness for a day or two. and it can be beneficial to take a non-steroidal anti-inflammatory medication like ibuprofen to manage that normal post-surgical discomfort for the first 3 days. You'll be advised not to brush the side where the surgery was done for 1 to 2 weeks after LANAP, and you'll be given a disinfecting mouth rinse to use during that time. Sometimes, but not all the time, antibiotics may be recommended to assist the body in its efforts to get rid of the harmful bacteria that have invaded your system. Finally, once the gums have started to heal and the teeth have started to stabilize, typically about a month after surgery, impressions or scans of the teeth can be made and a protective bite splint can be constructed to wear at night, preferably every night, for at least the first 6 months. I make occlusal guards or bite splints for all of my LANAP patients, even if they don't think they clench or grind during sleep. We all go through stages of sleep where significant jaw muscle activity occurs, and this is normal, it's just physiology. These episodes of rhythmic masticatory muscle activity tend to occur during the N2 stage of sleep, which is also where sleep spindles occur, which are thought to correspond to memory consolidation. Sometimes significant force can be applied to the teeth during these episodes, and wearing a bite splint while sleeping helps to protect your newly regenerating connective tissue and bone from these forces. Hopefully this has been helpful for you, and I wish you the best in your pursuit of optimal oral health.